Thank you so much for joining us today. I'm Mike Cal with BD Construction in Kearney. BD Construction specializes in rural healthcare, hospitals, clinics, additions and remodels to those types of facilities. And once in a while, we even get a build a brand new facility. In speaking with my clients, and I specialize working with healthcare clients, a lot of questions have come up about the funding these hospitals and facilities have received. Unfortunately, my knowledge level doesn't allow me to speak intelligently about federal funding programs for these hospitals through the CARES Act and the HEROES Act. So we have a guest today. Her name is Paige Gade, and she's going to share some thoughts with us. Would you like to introduce yourself, Paige?
Absolutely. Thank you so much for having me be a part of this conversation. My name is Paige Gade. I'm an attorney with Rembolt Ludtke. We are located in Lincoln, Nebraska, but we serve clients all over the state of Nebraska. And we have been spending a lot of time lately advising clients on the various coronavirus relief options that the federal government has passed. And a huge part of that has been the healthcare provisions.
So why don't we just start then kind of 1,000-foot level. Give us a brief overview of what the CARES Act is.
Sure. So the CARES Act, CARES stands for Coronavirus Aid, Relief, and Economic Security Act. And it was passed by Congress back in late March, I think it was officially signed into law in early April. And it just provides relief to various sectors, individuals, businesses, industries that were hit especially hard, and of course, healthcare, who has taken a huge role in the coronavirus pandemic. So specifically provides funding and relief for healthcare providers, hospitals, hospital preparedness, and supplemental funding for community health centers and Medicare reimbursements. It also provides relief for businesses in the form of the Paycheck Protection Program and employer tax relief credits.
So many of the healthcare facilities we work with have received funds. There was a large distribution, maybe several of them, from the government to these institutions. That money and the organizations we work with, primarily are critical access hospitals, have taken that money and are trying to understand what they're allowed to do with it. Instead of, I think they primarily banked it, and they have questions about what they're allowed to do and not to do with those funds.
Right. So the Department of Health and Human Services deposited billions of dollars across multiple healthcare organizations. And so the first round was a $30 billion payment that was just allocated in proportion to those Medicare fee-for-service payments in 2019. And then in the second round, there was $9.1 billion that was distributed, an additional $9.1 billion that was distributed to Medicare fee-for-services billing providers based on revenues from the CMS cost report data, and $10.9 billion available to Medicare fee-for-service billing providers based on revenue submissions to the provider portal.
Several of these institutions have received several payments. They've moved it to an account and it's sitting there. What are their options? Do we know?
So that's a common question that a lot of providers are asking, and there hasn't been a ton of guidance. There's been more guidance on what they're not allowed to spend those funds on, but the intent of these provider relief funds were really to help fill in a gap from loss in revenue or increased expenses due to COVID-19. So really anything related to COVID-19 will likely to be deemed a qualified expense that these provider relief funds can be spent on. Now, when a provider receives one of those, they have 90 days to either return the funds or attest and agree to the terms and conditions. However, if a provider does not return the funds within 90 days and has not made that attestation, they will just be deemed to have accepted the funds. And so what those terms and conditions set forth is what they're not allowed to use those for. And I'm going to read from my notes just to make sure I get these right. And this is not an exhaustive list. If anybody has questions, you should definitely reach out to an attorney to help you evaluate these. But it's going to be anything for payment of executive salaries above a certain limit, gun control advocacy, lobbying, limitations on abortions, embryo research, and promotion of legalization of controlled substances are some of the main categories for what the provider relief funds cannot be used for. So in terms of what they can be used for, it's really intended to be used to prevent, prepare for, and respond to the coronavirus and for healthcare related expenses or lost revenues that are attributable to coronavirus. So, for example, if a hospital had to stop providing elective procedures, then there was presumably a revenue loss for that. And so that would be considered, in most cases, a revenue loss due to coronavirus. And so some of the categories that these funds can be used for building or construction of temporary structures, leasing of properties, medical supplies and equipment, including personal protective equipment and testing supplies, increased workforce and trainings, emergency operation centers, retrofitting facilities, and surge capacity. And of course, all of this must be in response to the COVID-19 pandemic.